Hello, I'm Dr. Simon Rowbottom. I'm a psychologist. I work in private practice seeing clients for common mental health problems. Okay, so this question is, how often should you see your psychologist if you don't feel mentally stable? I can only speak to mine every 3 months max, and that's in the NHS. So this is a difficult question to answer, really. How often you should see a psychologist does depend on how you're feeling. Um, Oftentimes, we can move it to less frequently than a week if somebody's doing okay. But if you don't feel mentally stable, if you're struggling, then only speaking to someone every 3 months doesn't sound like enough. This is, I have to make a caveat here that really, the most important thing would be for you to talk about this with your psychologist. I would hope that you would be able to make contact with your NHS psychologist and actually talk about it to see that you can get that across, that you actually feel that you need to see them more often. Of course, the unfortunate thing with the NHS is that how often therapy and the duration, the length of therapy, is often not dictated by client need. It's often dictated by finance and what is available. So I think it's really important for you to talk to your psychologist. I would say if you weren't feeling mentally stable, then you need to see them more than every 3 months. Um, so it may be that if that's not available to you, what will be really important is seeking other sources of support. So if you seek other sources of support through places like Mind or even the Samaritans for emotional support, friends, there's often mental health befriending charities. I would say those kind of things are actually really, really important to support yourself at periods when you're not getting to see your psychologist. Question two. People close to me have suggested that I should talk to a therapist for past traumas, but talking about them makes me relive them. Am I wrong for not wanting to? Well, I'd say first and foremost, no, you're not wrong for not wanting to. I think it's perfectly normal that you would not want to relive past traumas. I guess the question I would ask is why are people close to you suggesting that you talk to a therapist? I guess the question is, are these past traumas continuing to affect you in the present? That is something that therapy can help with. This idea that dealing with past traumas is dealt with by just kind of talking through them with a therapist and then they're magically gone, it doesn't really wash in therapy anymore. One of the things about trauma that we're realizing, and there's a lot of research going into trauma at the moment, is that trauma is a situation where a person can't escape a life threatening or what's perceived to be a life threatening situation. And trauma is how the brain reacts to that. How the brain can often cut somebody off, it can often dissociate. It's how it reacts to extreme fear. So, what having trauma in your past can mean is that it can mean it continually affects you in the present. So, people have nightmares, they have flashbacks, they feel anxiety spikes, they can have panic attacks. It can affect people in a variety of ways. Now, what a therapist can do is they can help you with that without necessarily making you relive the things again. They can help you deal with the consequences of the trauma. They can help you with breathing exercises, relaxation exercises. They can help you deal with, sometimes we avoid difficult emotions that are brought up by trauma, and sometimes that can be the problem. So they can help you deal with the difficult emotions that your past experiences cause. So yeah, the answer really is that you're definitely not wrong for wanting to, but the question is probably for you is what might you stand to gain from going to therapy to look at any past traumas. I think this is a really good thing that you can talk about with any potential therapist. You can ask these questions. Any therapist really should be able to answer these questions for you. And if you don't feel that you get the answers satisfactorily, then maybe they're not the therapist for you. But the therapist that is right for you should be able to answer these questions to make you feel reassured that it is a good thing for you to do. So question 3, if a family member or friend is suffering from severe mental health issues and has told you not to tell anyone, but you're worried, what's the best thing to do? Okay, so in this situation, I think it depends on what the severity of the mental health issue is. I suppose the first port of call would be to actually try to encourage your friend to speak to somebody, to see your GP for a starting point, or maybe contact a therapist. Because if these issues are severe, then we are talking about elements of risk. Severe can mean suicidality. It can mean self-harm, and these are obviously very risky behaviors. It is a very difficult situation that somebody's told you. If somebody's asked you not to tell anyone, then I think what you can be is you can be a support to that person. You can encourage them to talk to other people, to seek further help, but you can also listen, because you're likely to be the only source of support that they've got. So you can really try not to judge, listen to what they're going through, keep in constant contact. But then you have to make the decision for yourself as a support to that family member or friend that if their behavior is becoming too risky, you may have to best protect them, you may have to break their confidence. And this is something that we do in therapy. Everything within the therapy session is confidential, aside from if we believe that there's a risk to somebody, a risk of harm, a risk of serious harm to themselves or anybody else. In these instances, we do have to break confidentiality. And so I would say that if you believe that your friend is in danger, if they're in danger of hurting themselves in any way, then I would say that the responsibility is probably to try and contact somebody. Now, that may be to try and contact the police if you believe that there is an instant, if you believe that there's an immediate threat. But it may be to contact other family members who can also then support you, because the other thing is that it is very, very difficult to carry the weight of something like that by yourself. So you've also got to bear in mind what's good for you as somebody who is supporting somebody with these severe mental health issues. But I would say when the level of severity gets quite high, when you're talking about suicidality, we've got to recognize that actually the best interest, what is in the best interest for somebody might not necessarily be something that they want. Question 4. I feel like I'm stuck in my past and unable to handle my future. My past feels like my safety space. I find myself analyzing my past actions constantly. I know what my problems are, but I find myself week after week repeating the same cycle, like a sort of life loop. My self-esteem is really low, especially lately. How do I break this cycle? So there's a lot going on in that question. And I think when I read it through, there were two things that cropped up for me. One is the saying, I'm stuck in my past and unable to handle my future. Now, what I think is helpful to understand here is that actually what's going on is an artifact of the way that our minds work, the way that our minds have developed through evolution. So one of the things that we have is that we have our minds, we have our thinking mind, that other animals, no other organism on the planet has it. We have our thinking mind that gives us intelligence and language and music and culture and pretty much everything we have as human beings. The problem with that is that what that's also given us is an inability to stay in the present. The mind, because it's constantly working, is always trying to find something to feed on. People think that the mind is like a laptop that's kind of sitting open and it's not doing anything. It's lying dormant until we come to use it. But actually, it's like a voracious animal. It's just like something that's constantly looking for something to chew on. And the issue is that what it always looks for is it looks for something in the past or it looks for something in the future. So in the past, it will go to things that will say, so why did I do that? And what was it that made me do that? Did I do the right thing? So the person who asked the question says, I find myself analyzing my past actions constantly. And then the part when they say they're unable to handle the future, what happens there is that the mind is constantly saying, well, what if? Because we're animals, we're fixated on danger. We need to keep ourselves safe. We're always saying, what if this happens? What if that happens? And the mind finds it incredibly difficult to just rest in the present, to rest with what's actually happening now. And so it will always go to the past or the future. These cycles going on and on and on, they can really begin to affect us. Being worried about the future the whole time can really develop into an anxiety disorder. And being stuck in the past means that we're constantly going over what we've done. We're criticizing what we've done in the past. We're thinking through things that we should have done. And our self-esteem gets very, very low. So how do I break this cycle was the question. Well, I mean, that for me really feels like a very good candidate for what I would call mindfulness-based cognitive therapy. You can look for cognitive therapists who provide this. Most of them will now. And what that really is that it's really a kind of an education or an understanding of why our mind does this, and actually training ourselves to defuse from those thoughts when they go. Because what happens is our mind will naturally do this, but we tend to have a tendency to believe that these things that we think are reality or the truth, without being able to just detach from them, see them as kind of artifacts and cognitive events of a mind that can't stay still. So I think that breaking the cycle may be really helpful if you went to see, read a bit about mindfulness, cognitive based therapy, and approach somebody and see whether that is something that might chime with you to actually look at those thoughts in a different way. Question 5. Why do you believe male suicide rates are so high, and what can be done to lower them? That's a very, very good question. There's a lot of research being done into male suicide rates because, there's a lot of information out there that male suicide rates are very, very high. Personally, through the research that I did, my doctoral research was involved in looking at masculinity and looking at what we would call the traditional male gender role. So the traditional male gender role has really kind of been around since, I guess, the mid-20th century, which is this idea that males should be breadwinners, they should be strong, they should be unemotional, they should be the rock that everybody falls back on, these kind of things. Now, a lot of research around this area has demonstrated that this traditional male role is extremely problematic for a couple of reasons. One, it's problematic if males actually achieve this. If they actually do achieve this, what this means is that they have a tremendous amount of pressure on themselves. They don't connect with other people emotionally. They don't connect with their families emotionally. They lose out a hell of a lot. What it also means is that men who strive to achieve this, and it's a very, very difficult thing to achieve, often fail. And so they feel that they're failing as a man. They feel they're not strong enough. They feel they don't make enough money. They're not supporting their family in the right way. And so this traditional male gender role is a very, very difficult one. That has been changing over the last 20, 25 years, 30 years. That's gradually been changing. So the idea is we have now a more kind of metrosexual male. We have different types of masculinity. We have different ways of being. But the traditional male gender role still dominates in an awful lot of media. It still dominates in an awful lot of culture, and it still goes through. And what this means is that there's actually probably a crisis in masculinity, in that men don't really know what to be anymore. They don't know whether they're succeeding. They don't know whether they're failing. And a lot of the time, they feel that they're failing. Once they feel that they're failing, the problem comes because men are not especially well versed, well trained in, I guess, in what we would call emotional intelligence, emotional understanding. The traditional female gender role tends to have that within it, men's doesn't. And so they then struggle to make sense of what's going on for them, why they feel they do. They feel that if they're not coping, they're somehow a failure, they're not strong enough. They get very, very confused. And so they feel that suicide is probably the only option for them. They feel life can't get better. They don't know what's happening to them. And sometimes it appears like it's the only option. This is why it's really, really important for men to talk. That is the main thing that could be done to lower these male suicide rates is an educative understanding of what it is that men specifically go through with their mental health. It is, I do believe, it is qualitatively different from I guess from other gender roles, and so that understanding needs to be put out there and the understanding needs to come from why we are all prone to mental health problems, but for men who try to conform to these particular gender role norms, it's even more difficult. So that's my personal feeling about why they're so high and what should be done. So that's it for me. I've been Dr. Simon Rowbottom. Thank you so much for letting me take part. I've really enjoyed answering these questions. I think they were very, very insightful questions, and I think it shows that there's an awful lot of questions out there. People want information. My goal at the moment is to help educate people around this. So it would be lovely. People could feel free to have a look at my website, which is chilternpsychologicalservices.co.uk. And feel free to, there's email contact on there. Feel free to email any questions, or if you'd like to get in touch about any presentations I might be offering in the future, that would be wonderful. But thank you for your questions.
Hi, Brett from DGN here. Thank you so much for watching the episode. I hope you enjoyed it. And thank you to Simon for coming on to answer your questions that you sent in. The show has been rebranded from Is It Normal If I to Ask Away after popular demand. And we're intending to make it more of a regular staple on our channel for people to send in questions and get the chance to ask experts and people with specific experiences about topics that we might not generally get the chance to talk about or the opportunity to. If you would like to see anybody in particular on the show, please let us know in the comments below or on social media, and we will try our best to feature those people on the show. But in the meantime, subscribe and stay tuned for more.